Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am here today with Lauren DeMoss, a Maynard Nexsen healthcare attorney in our Birmingham, Alabama studio.
Yes, thank you, Heather. We're happy to have y'all here in Birmingham.
It is good to be here. It's a beautiful view and a good day here in Birmingham. We are excited to have with us today a former Maynard Nexsen attorney, Steve McPheeters. He now serves as the Executive Vice President and Chief Legal Officer at HighFive Healthcare. Steve, thank you for joining us.
Glad to be here. Thanks for having me.
Can you start us off by telling us a little bit about your role, your company, how it works with endodontics and oral surgery, and then how you benefit providers?
Sure. So in my role, I'm Chief Legal Officer, and that kind of embodies all aspects of legal. Here at Maynard, I was primarily a mergers and acquisition attorney, and we move into, you got employment, you've got privacy and security, you've got, some areas that Lauren's doing. So you blend into a lot of different areas, benefits, IT, privacy, just really across the gamut. So no day is really the same. And things that I used to call my partners about, the things that I've now I've got another lawyer who's also a Maynard alum, Zach Guzet. And so we try to tag team those, and then we still get to talk to Lauren and other folks that we've dealt with, what we used to deal with when we were here. So it's been great.
Good.
Yeah, I'm sorry. I would say we're still glad to get to talk to you, Steve.
Yeah,
we miss having you here, but still glad to be able to talk to you.
Still know everybody's extensions by heart, so that's great. Yeah. And HighFive is involved. We're kind of aggregating endodontic practices and oral surgery practices, and we're in 10 states, all Southeast. We're about half and half right now, and we're majority owned by doctors. So that's sort of a unique aspect of our company. So we're doctor centered and also doctor majority owned.
Thank you.
Steve, in your role with HighFive, I'm curious what kind of keeps you up at night, and whether I know there's probably some legal concerns, but are there other operational things, like when you think about biggest risk, what comes to mind? Yeah,
well, so that's, I think, one that's kind of been prevalent in healthcare and in all businesses lately is really privacy and security. Kind of clearinghouses that help with our payer reimbursement. Change Healthcare, that was a big deal. A lot of the really big, especially in healthcare, there's a number of big data breaches, and obviously they're getting, I probably I've gotten 5 or 6 in the mail in the last 4 or 5 months. And when, they're also, so that all cascades down and impacts practices because they all have to use those big companies to get their billing through and get it to payers and process it all, because everything's electronic these days. So that's probably the number one, and a lot of that's out of my control. And I'm not an IT person, but that's probably the top. There's others. I think the labor market is not as strained as it was, but that's another one that still is a challenge, especially because we're in so many different geographies. And then I think, in healthcare in general with doctors and dentists, there's a shortage. I think you got a lot of folks who are retiring. In oral surgery and endodontics specifically, since their specialty, there aren't that many graduating every year. So I think recruiting and retention is a big issue for us. Fortunately, we've got some folks on our BD team that's all they're focused on. So they go all across the different dental schools and in their training and keep in touch with them. And we're actively recruiting all the time.
I think about the data privacy being number one and the Change Healthcare. I feel like that kind of showed providers. Sometimes it's, it keeps you up at night, but making sure everyone else knows that that's something that is a real risk to the practice and to the business. I feel like the Change Healthcare showed how it could impact operations substantially. A data breach that really filtered all the way down, that everyday operations were impacted. So maybe that was the silver lining, was that it was a helpful way to show the physicians, everyone, that you have to take data privacy so seriously.
You're right. And you can be, I know like United Healthcare and the companies have all the the resources to try to prevent that, and still they weren't able to do so. So just shows you in oral surgery and endodontic practices tend to be smaller in size than, say, like cardiology and orthopedic, which may have 50, 60 providers. I think a large endodontic or oral surgery practice would be 5. So it's even more so as far as the cost of protecting yourself. When you're smaller, it's spread out between less people.
Yeah, it's more expensive.
We've seen more and more mergers and acquisitions in the healthcare industry. What are you seeing from your perspective regarding trends and maybe what providers should be thinking about?
Yeah, I think it's kind of gone is throughout. Many specialties kind of started more so in our industry, kind of in general dentistry, but I think specialty. Kind of seeing them more aggregate is more recent than general dentistry. I think it's like anything. It's picking a partner that you mesh well with, have the same values. I think each one's a little different. We're trying to do a lot of the same things. We may have different ways of getting there, but I do think we'll continue to see more consolidation because as technology comes in, it's more expensive. And can put more expense pressures on a practice, especially one that only has a few practitioners. So I think that's one of the big things. I also think that interest rates, they've gone up some. So I think M&A activity slowed a little bit. When I first joined HighFive and back in 2021, I mean, interest rates were really low. Cost of capital was quite a bit lower, and they're coming down a little bit, but they haven't come down a lot. So I think that impacts valuations because of the cost of capital. So we'll see. I'm optimistic things are going to look good this year, and we'll continue to have some interest rate reduction as well.
Steve, you mentioned the recruitment and having the workforce and going to dental schools and across the country. Are there foreign medical graduates or dentals that you recruit from that would be on a visa? I know obviously that's the case in the medical side, but I didn't know if that was the case on the dental side.
They do. They have, I think of one right now where the doctor we're talking to is from Canada. Mm-hmm. He was, he's a Canadian citizen, but they went to school here and is thinking about moving down south. He's, I guess, ready to get away from the colder weather, even though he wouldn't know it today. But yeah, so there's some of that. It's interesting. A lot of the certain schools probably have a more focus on that, and others. It's so competitive for the specialties, and there's so few who are accepted in the fellowships and the internships that like for example, UAB tries to. I think they have a state residents. They have to focus on that, and some others around. But there's some that seem to be more international focus.
Are there staffing shortages with other clinical, like the non-dentist, non-endodontist, and other kind of clinical staff? Is that a difficult recruitment?
I think so, and I think you see, it's also there's a lot of places those folks can go. So especially, it's interesting because certain regions or cities are harder labor markets than others. Some of our doctors are in smaller towns, and those tend to be more stable, just because they've. But when you're in a larger city, it seems like sometimes the harder it is to retain people.
Yeah. Speaking of kind of different cities, and y'all's geographic scope is rather big, do you see kind of different challenges that the practices have depending on the geography, or do you feel like it's kind of they all have the same kind of challenges or support they look to you for in terms of their operations?
Some of them are the same kind of across all practices, but definitely geography. For example, if you're in a smaller, more rural area, it's harder to recruit like doctors because they either want to have one been from there or two be looking for that specific locale. If you're in more of a metropolitan area, there will be more competition for the doctors, but there are a lot more doctors looking at that area. So that's one from a recruitment standpoint that definitely is geography. A lot of the other things are kind of across the board for the most part.
Yeah, pretty consistent
Right,
between
right.
the different locations.
Almost every guest that we've had in the past, I don't know, year has talked about AI somehow in relation to what they're doing. So give me your thoughts on AI, on technology, how maybe you're seeing it leveraged, or maybe even just how your industry is talking about using it.
Yeah, so it'd probably be better to have my colleague Zach, who was with us before. He's super up to speed on all the technology. I'm probably lagging behind, but yeah, AI it's used in everything, and we are utilizing it. I think we're probably a little wait and see kind of thing, just because of we're in a regulated industry and want to make sure before we, use some of those things that they're going to work and they're going to have good results. So there are some we have kind of pilot projects going on with, but we haven't rolled out a lot of AI yet in the practices or even at home base, just because we're taking a wait and see approach. But certainly you're inundated with information. I think that's one of the hard things for me is not a really tech savvy, is when I read it, there's so many different things. How do you differentiate and what works and what doesn't work? I think that's where fortunately we have good IT folks and obviously other people who are more up on technology. But it's definitely, I probably get 3 or 4 emails a day about it, and try to read it, but it's hard for me to keep up with all of it.
So totally. As last night, one of the partners here emailed me about an AI platform that you can dump documents into it and it will generate a podcast of 2 people talking. I'm like, what? That's not even something that was on my radar screen of could be.
My 8th grader did that. Now that you mentioned that. Yes, I actually, that you say that, yes. I didn't know it had that capability either.
I was like, that's a testimony to my level of expertise with technology as well.
Well, and I think there's a generational gap in trepidation, because I think, it makes me nervous. I know it makes the clinicians nervous, in different areas to rely on it for certain things, which I think slows the adoption of it. Plus, to your point, Steve, we don't really have good guidance, in terms of when you can use it, when it's okay to use it, when it's not okay to use it, and what, are you relying on AI to practice medicine? There are just so many questions out there.
Right. I think that's true. And in kind of what we do, I'm always focused on what's the risk. And I don't know there's enough information out there yet to know, maybe an unintended consequence or a risk that maybe you haven't seen around the corner yet.
Yes.
Yeah, we'll just have to, we'll keep asking all of our guests. This may be a question we ask for
everybody.
For the next several years,
Sure.
Yes.
as more comes out and we try to learn how to work it into what we're doing. Yeah.
That's right.
Yeah.
Well, Steve McPheeters, welcome back to Maynard Nexsen then. And
It's good to be back.
Yeah, it is good to have you here. Executive Vice President, Chief Legal Officer at HighFive Healthcare. We appreciate you taking the time. Hope you'll consider coming back again and as trends continue to change and giving us an update.
I'd love to. Thanks for having me. And as always, good to see you, Lauren.
Yeah.
And it's good to see you. And it's good just to walk around here. I'm used to this place and don't have my
Key card.
I don't know the combination, but yeah.
The code. We'll always let you in, Steve.
Right,
That's right.
right.
There's always a place.
That's right.
For those of you who joined us today, we hope you enjoyed our conversation about this specific area of healthcare, and we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.